everybody. Welcome back to Psychedelics Today. This is Joe Moore coming at you again from Breckenridge, Colorado. Today on the show, we have Dr. Thomas out of Boulder, Colorado. Dr. Thomas has a integrative psychiatry practice and also does a bunch of work with his clients with ketamine. And I think that's the bulk of the conversation here. It's been a bit since we recorded, but it was a really fun conversation. I'm really appreciating getting to know Dr. Thomas. The gentleman who helps us out here, Rob, with our audio, pointed him out to us recently and immediately reached out. And turns out he's been a great connection so far. So thank you, Rob. Thank you, Dr. Thomas, for your time. This is a really fun episode to record. And yeah, you actually even helped me get on a really interesting panel conversation affiliated to a much larger conference recently. So that was really great of you. So thanks for including me on that. And I think that's it for the intro. I actually earlier today just had my first intramuscular ketamine injection, so I'm a little tired, but that was a really interesting experience. So expect a little bit more on that soon. I wouldn't be surprised if we do kind of like an experience roundup, Kyle and I, on the next Friday episode, but we'll see what we can make happen there. And yeah, I think that's it for Dr. Thomas. And reminder that we have a CE-approved class called Navigating Psychedelics for Clinicians and Therapists. That's a live supported class with a whole mess of pre-recorded material that you can work through outside of class, and you come to class to discuss it. It's been an amazing project for Kyle and I so far, and we are really excited about this January edition. So if you're inclined, check it out at psychedeliceducationcenter.com. And I think that's it. We'll see you on the other side. Hi, everybody. Welcome back to Psychedelics Today. Today on the show, we have a special guest, Dr. Thomas from Clarity Psychiatry in Boulder, Colorado. And Dr. Thomas, you do ketamine-assisted psychotherapy in Boulder. Is that right?
I do.
Yeah.
I do.
Is that the majority of your practice at this point, or are you doing other stuff?
No, I would actually. It's the majority of the fun in my practice.
Yeah, right. So you're still doing kind of like traditional psychiatry,
I do actually a mix. If I take a guess, I do about probably, let's say, 50% ish, 60% conventional psychiatry. Medication management. So, and then I do about maybe, let's say, another 25% ish, what I call holistic or integrative psychiatry.
Yeah.
So, which is a different kind of worldview or paradigm of mental health treatment. And locally, let me just give a shout out to Dr. Will Vanderweer, who's, locally considered to be just the guru of holistic, psychiatry, sort of looking at essentially.
I didn't realize he was in Boulder.
Yeah, he's in Boulder. Yeah, he's got the oldest and arguably the most respected practice. Just a quick blurb on that. What is the holistic or integrative psychiatry? Basically, a field of psychiatry and mental health that's looking to really be alive to root causes of people's issues, and to not content ourselves with providing medication simply to suppress symptoms.
Mm-hmm.
Of course, don't get me wrong, suppressing symptoms can be life-saving, but for many of the people who end up, seeking Dr. Vanderweer and seeking my practice, they're not really satisfied with that approach for a variety of reasons. So, and there's plenty that we can do with natural alternatives. So I'll leave it at that for now, unless you want to know more. And then the last piece is the psychedelic work with the ketamine-assisted psychotherapy.
Cool. I want to dig in just a little briefly on this integrative psychiatry concept or holistic angle. So yeah, like typically we look at symptom reduction, I think, not necessarily always root cause.
Right.
And it's not always financially reasonable for people to engage in something that's like, all right, why am I having this? Sometimes it's really expensive.
I completely agree. And I'm alive to those issues.
Yeah. So it's an interesting problem to address. Like, do you will you typically start with a conventional approach, and then as stuff doesn't really sort out, you might look at nutrition,
That's
lifestyle, stuff like that?
such a good question. And before I even answer that question,
Sure.
I really want to make it clear I am not denigrating, in any way my allopathic psychiatric colleagues. I was that guy for many years, and I think it, did people a lot of good. I think the issue that I see is just it's really about, if the resources are available, how do we tailor treatment to what they really want, to what somebody really wants. So now that brings us to the issue of how do I decide, right? Somebody comes to me, okay, let's put it this way. Joe, nobody's coming to me generally because they're feeling so great and they want to feel even better, right?
I would, but I hear you.
Okay, maybe with the exception of you.
Yeah.
Pretty much everybody that's coming to me in some way, shape, or form is suffering,
Yeah.
and they want relief. And that's a very understandable human need. I would want the same. Okay, so to the short answer, Joe, is what my approach is largely going to be driven by what the person's looking for and what they're specifically asking for. So let me give you an example.
Sure.
Right. So somebody comes, somebody comes to me, unfortunately, deeply depressed. That's a very common presentation. All right. So in general, the person who's deeply depressed, they want out of it. They want their life back. Mm-hmm. So they want to function again. So I'm generally, I'm a very pragmatic clinician. I want them to get better. We need their symptom burden to at least ease if we have sort of any chance of meaningful recovery. And even potentially having the conversation at some point of how do we do things more naturally. So, the more severe the case, the more likely it is we're going to lead with meds, right? Mm-hmm. Even if the person's preference, is that we don't do meds. I mean, I'll respect that if I can, but if things get too bad, I'm just going to tell them that I don't think it's in their best interest to completely avoid meds initially.
Totally. Yeah. We totally talk about that. For acute need, it's great. Let's get you manageable.
Nothing wrong with it. Absolutely nothing wrong with it. Okay. So, but let's say that same person had very strong opinions, which many of my patients do. Doc, I really don't want to be on this stuff forever. And I've tried, other doctors in the past, they haven't really wanted to take me off. And so I'm going to be I'd like to think I'd be much more open to having that conversation, saying, yes, I would love that for you too. And let's see what we can do to build a solid foundation of health. Build a strong house so that we can get away with removing those meds down the road, and and actually have the person function just as well, if not better than they did with the meds on board. And there's so many details, Joe, so many contingencies. In some cases, that's just not ethical, to even promise people the possibility of going off meds.
Right.
For example, somebody has really severe bipolar disorder, schizophrenia. It's just not a wise thing to do, to plant hope that we're going to get them med free. It's not likely to happen. I think the more realistic hope is maybe can we reduce? Can we get somebody on fewer meds, lower doses, lower side effects by doing more and more natural approaches, supporting the system? With other things, and emphasizing to people that they're in the driver's seat, that especially as they get better, we're going to put more and more responsibility on them to take charge of their health by doing some of the lifestyle changes that could really support their health. For example, simple things like, eating a cleaner diet, a more whole foods based diet if possible, engaging in centering, grounding activities, whether it's yoga, meditation, hitting the ski slopes like you do, whatever, getting your body moving. These are just a few examples of lifestyle changes that I really like to emphasize.
Yeah, cool.
Yeah, I could certainly go on more, but that's just one way of approaching things. And what I also like to do is I really like to start out with most people. If they haven't had a complete blood work panel, I really like to order a blood work panel because, I mean, one interesting paradox about life in America is that nutritionally we're starving in a sea of plenty.
Oh yeah.
Yeah, right. Calories abound, but yet real nutrition, paradoxically, can be hard to find, right?
So what kind of things in a panel? Like D
Yes,
omegas?
I start generally with a very simple panel that I'm pretty confident people's insurances are going to pay for.
Yeah.
So I'm going to start with the same that a lot of doctors might start with, what we call a basic chemistry panel. Looking for things like their sodium, potassium, their liver enzymes, things like that. A blood count to see if they're anemic or maybe have an active infection.
Mm-hmm.
I will typically, on almost everybody, I'm going to order a vitamin D level because it's just so epidemic in our country.
Yep.
That vitamin D levels are low, and it really does cost the body and brain when that's true. Iron panels, I'm usually going to order thyroid panels. I'm going to check people's B12 and folate. So from a functional or holistic point of view, this is really low-lying fruit. This is easy stuff in general which is remarkably easy to treat. And so from my point of view, it's kind of like, I don't want to be the guy that misses that low-lying fruit, because we can really help people by just giving their brain the absolute basics of what it needs. Joe, other people come to me, kind of from a different stance. They really, like, they're on meds, they want to be off of them, and they haven't been able to get away with it. And, and if it's appropriate, I may guide them in that direction, or at the very least moving towards reduction.
Yeah.
So for us holistic psychiatrists, our mantra is generally, when it comes to meds, less is best. Mm-hmm. In general. There are exceptions, but that's the frequent refrain.
Yeah. Yeah, as little of the drug as possible to get the job done. Yeah, we've heard that a lot on the show from others, and I think that's a really great advice. Like, let's not really just put you on the standard dose. Start light.
Yeah. Well, and also to encourage people to really check in with what the medicine is doing for them, and really emphasize that it's their body and their choice.
Yeah.
With very few exceptions. And I tell my patients, if the medicine I am giving you is causing you to feel zombified or out of it, or just not yourself, that's where we either got you on the wrong medicine or the wrong dose. Mm-hmm. Because the whole point of pharmacotherapy is to help somebody to become a better version of themselves. And I think that should be true of any therapy.
Yeah.
Yeah.
It's a big deal. Vitamin D3, by the way, did you see Fauci just came out about it helping with symptomology for COVID?
Yeah.
Finally.
Fine. Yeah, I'm glad you said it and I didn't.
Yeah, he can't take my license away.
Right. Yeah. And there are some, and that's a separate conversation. So I'll
right.
Not just, there's a couple other really low-lying fruits that really I'm taking every day that could really decrease our risk of COVID transmission, or if we got it, we're going to have a much milder version. And why not? Let me just mention them. Probably, the biggies, that are super easy for immune support. Vitamin D, we already talked about it. Vitamin C, usually, around the range of minimum 500 milligrams twice a day. For many people, twice that. I probably take 3 times that. And the other one, that's worth to thinking about is zinc. Mm-hmm. Really powerful immune, booster that really doesn't, in my opinion, and those of many of my tribe, doesn't get a lot of press.
What kind of dosage with zinc would you think is the lower end?
Somebody is, but as a general, For somebody who is not really, we're not suspicious of true deficiency, 30 milligrams should be plenty. A good multivitamin, like the one that I use myself, has about that. If I've got reason to think that somebody's deficient, I'm usually, aiming more towards 50 to 60 milligrams.
Mm-hmm.
But it can be really, really profound in terms of
Yeah.
the benefit on the immune system and on the brain.
Mm-hmm.
Almost everybody that I see, Joe, I recommend that they take a multivitamin, like a really good multivitamin. And as you know, out here in Boulder, we're vitamin snobs. So I want people.
Right. So you don't want the $3 bottle that lasts you 2 months. You want something that's like 50 a month or something like that.
Forgive me if there's any King Soopers representatives out there, but I don't want the King Soopers brand.
Right.
Okay?
Yeah. I hear you.
But on the other hand, I don't want people getting ripped off. So there's happy mediums. So I usually tell people, I send people a link to the same multi that I take and make sure they get a good deal on it.
Nice.
Feel
Cool.
good about it. Yeah. And the reasoning for that is that I know whatever medication I choose, if we're giving the brain more of the building blocks of what it needs, we're going to get more mileage. Maybe
Mm-hmm.
I don't have to be in the position of like constantly increasing doses or adding more and more medicines because the other ones weren't enough. That we could just help this exquisite brain of ours that's been honed through, millennia to work really well, and trust it that it knows what it's doing if we give it what it needs.
Right. Yeah, it's a weird conversation to have, right? Like this seems to me like it should be really common sense, but in our kind of like McDonald's, Walmart culture, we don't really think about basic building blocks too often.
Yeah. Yeah, I totally agree.
Yeah.
And so, from a very selfish perspective, I'll put people on it just because I know it's going to make my life easier.
Yeah.
And then, from an unselfish perspective, I know it's going to make their life easier. Generally.
Right. Absolutely. Like
So
super low risk.
Yeah, super low risk. And okay, so I don't want to you want to know this. I'll give you my triad that pretty much almost anybody that comes to see me is going to get a recommendation for this triad once. All right. Number one, high quality, broad spectrum multivitamin that has a good dose of zinc and a good dose of methylfolate. All right. The brand that I tend to recommend is called Pure Encapsulations. Pure Genomics, Pure Encapsulations. You can get it off Amazon, or if they see me, I'll give them a deal. Right? I'll suggest almost everybody take extra high quality absorbable magnesium. Why? Because magnesium is also typically low in the American diet. Most Americans are deficient if you use high standards. And if you use actually a good magnesium that gets absorbed, it can do wonders for the brain. It tends to, once again, boost the effects of any medication, specifically for mood or anxiety. It tends to have an independent anti-anxiety, anti-stress effect, tends to improve memory and concentration, and tends to naturally promote better sleep quality. Sounds like a good deal, huh?
Yeah, bargain.
Yeah. And so I typically recommend, there's so many good ones out there, but there's so much junk out there too. The detail's important. I usually recommend a brand called Designs for Health, magnesium malate. And then the last thing I recommend almost everybody, unless they're a vegetarian, is fish oil. Minimum 3,000 milligrams of high quality fish oil a day with a meal. Just the omega-3s are so good for the brain. Just over time promote brighter moods, lower anxiety, better heart health. Oh, and the ladies love it because they get shinier hair, skin, and nails. Great.
I have some family members that went vegan recently, and I've been concerned about that. And I found some decent brand names with some vegan options for DHA EPA, which is kind of cool too.
I never try to convert people. I want to respect we can work with it. We can work with it. If they're going to be a vegan, I just want them to be a smart vegan.
Ideology is not that important to health.
Eh.
Well, sometimes it is. All right, Dr. Thomas, you want to start jumping into the really fun topic?
Yeah, let's do it.
Cool. So ketamine-assisted psychotherapy, been a huge topic lately for us at Psychedelics today.
Right.
We're seeing a lot of kind of, I hate to say it this way, but pump and dump clinics that just like, all right, cool. Like, yeah, here's your Xanax. Here's your injection of ketamine. You can get out of here, drive yourself home in 3 hours or something. like something crazy like that.
I'm,
But
I'm gonna put on my politically correct hat.
Go for it.
I know a lot of those clinics, and I really do think, on the whole, they do good work. I've got really good friends and colleagues who do that work, and I think it can be done very well. And I think it's doing, honestly, a service to the society as a whole. And just for the audience, let me give them a little background.
Sure.
So let's say a typical person who might be interested in going to a ketamine infusion clinic is, let's say, the person with very severe depression. This poor person, they've tried all these meds, nothing's working. They're getting desperate. They're thinking about electroconvulsive therapy. So instead, they go off to an infusion clinic, and typically what's going to happen is they're going to enter like a very medicalized setting. And often with other clients in the room, they're going to get hooked up to an IV. There's going to be a nurse who diligently checks on them and checks their blood pressure and their other vital signs and their oxygenation levels. And, they're going to get dripped for about, at a extremely conservative dose for the first one, 0.5 milligrams per kilogram of body weight. And it's going to happen over 40 minutes, and then they're going to have 20 minutes to kind of recover. So in terms of what they experience, they're generally going to experience kind of just an effect maybe similar to that of having a drink or two, right? It's a little loose, a little swimmy, a little dreamy. And if they're really lucky, repeat that process 4 to 5 times at 500 at minimum a pop, and their depression is, getting a lot better.
Totally.
And that's great, because they may get their life back with that. So, and what that's speaking to is the power of the chemical molecule of ketamine. It's an incredibly powerful molecule, and that model, that worldview, exploits that to great, I think, to really socially beneficial ends. The challenge I have with that, the problem, I don't want to say problem, but the kind of the issue that I think comes up in that model is there's a couple. Okay. Number one, the person who tends to do really well in that model almost always needs to be maintained. If they want to stay well, and the ketamine is the only thing that's getting them well, they need to stay on the ketamine to keep them well. So they need to keep coming in at intervals. I mean, if they're lucky, they can slow it down, maybe once every 2 weeks, 3 weeks, 4 weeks, whatever. But they're going to keep coming back. So they are, they're kind of now dependent on ketamine. And there's nothing wrong with that. I think you can make an argument that it may be better to be on ketamine than some other agents. I don't know. I don't want to, speak kind of, unilaterally across the board on that, but some people might agree with that, that statement. But the other challenge with potential challenge with that model is for the sensitive patient. Okay. The patient who their system is just really, really sensitive, and the same low dose that for another person might get them a little woozy, like as if they had a drink or two, for the sensitive person, it can send them to true psychedelic space. And the challenge is many of these clinics are not, they're not run by people who necessarily have training in guiding people safely through some version of a psychedelic experience. I'm not blaming them. It's just not their training. And there's often, what I hear from many patients who've done the IV infusion method is that they felt they were unsupported. Mm-hmm. Here they were. So let's say we hooked you up to an IV. You were a really sensitive guy. No one told you that you could be entering a profound psychedelic state, yet here you are. And you're in a medical suite, there's beeping, there's this blood pressure cuff that's going off. It can be very disorienting. And unfortunately, in many cases, those people who have this experiences, there's no real support for them even after they go home. They're like, what the heck just happened? Mm-hmm. And maybe some of their stuff their shadow material came up. I tend to hear from some of those people that model of ketamine could theoretically be somewhat traumatizing to them. All right. Not all the time. I don't want to make a unilateral statement like that. It can be life-saving. All right. So the third kind of, potential issue with that model is the issue of, let's call it the missed opportunity.
Yeah.
Okay, what do I mean? If my understanding of the conventional, allopathic approach to the IV and ketamine experience, it's that the altered state that ketamine can induce, like so many other agents with psychedelic properties, is in mainstream, in the mainstream worldview, can be considered basically an annoying side effect, right?
Mm-hmm.
It has to be tolerated because that's part of the package, but at the very least, it can be reduced by clever dosing. And, the main problem with that in the worldview, my worldview and the people who trained me was that that's missing such an opportunity, because if you gave that same medication in a safe, contained environment, preferably as non-medicalized as possible, like a comfy office with cozy couches and nice pictures and soothing color tones, they enter into some degree of a psychedelic or expanded state, there can be such tremendous learning that happens. Because with the conventional model, there's often not a lot of learning that happens. The learning that happens is you feel bad, you show up, you get dripped, you eventually feel better. I mean, that's an oversimplification, and pardon me if my IV infusion colleagues are listening to me, but that's my opinion. But with what they call the transformational approach, we can have people really tap into this gold mine where we are giving full rein to their inner healing intelligence. It's not me as the doctor that's really doing a lot. It's the medicine is facilitating, but it's their own, in my worldview, their own inner healing intelligence that now gets the mic. It gets to say, wow, finally, I'm going to take advantage of this opportunity. I'm going to communicate what this person needs to know. And people can have tremendous insights into their life. They can have tremendous alignment with what's most important to them. Whether it's their higher power as they see it, whether it's to their core values, whether it's to the people they love, whatever. They can really get tuned in and tuned up. And in the worldview of the way I was trained, the whole point of ketamine therapy is not to get somebody hooked on ketamine for the rest of their life.
Right.
It's to give them enough corrective, expanded experiences of healing and of their own inherent wholeness that they don't need the ketamine, that whatever was off balance is coming right. So that's, and I'm not, even though it's pretty clear that I've got a strong opinion on this, it's not a either or, but both can be helpful. But I just think that this way of working with the ketamine with a very psychotherapeutic focus, using this experience as a chance for people to learn more about themselves and to self-correct. And under the guidance of a warm-hearted, loving, guide who knows what they're doing and knows how to, help people navigate this very special experience. Mm-hmm. And I think we're just really, really lucky that we have this tool available to us, and it's legal. I often have to remind people, because I just wanted to remind you here, what you just experienced, that amazing wonderland of yourself that you just entered, that was legal.
Yeah.
Let that sink in.
Yeah. In our classes, people are always, I can't wait for psychedelic psychotherapy to be legal. And Kyle and I always have to remind folks, it's here now. It's legal now.
Yeah. Yeah, it's true. And it's just that, for various reasons, the word is not completely out that ketamine is a true psychedelic agent. And I'd like to humbly make the assertion that it absolutely is. And a lot of the magic of the the expanded states experience of ketamine. A lot of it has to do with dosing. In some ways, ketamine, you can think of ketamine a little bit like a chameleon, right? A chameleon can change colors depending upon what environment it's found in. Ketamine is similar, but instead of changing colors, the experience can vastly change depending upon the dosing environment. What do I mean? Ketamine at very low doses can be marvelous for treating physical pain, often pain that's resistant to high dose, opiate treatment. It can be a wonderful alternative. Ketamine at low doses can be a tremendous anxiety reducing agent. It was originally developed in the 60s. It cut its teeth in the Vietnam War. I tell people, if you were a soldier and you took fire in Nam, you really, really hoped your buddy had some ketamine in his pack to give you, while you're being feely backed out.
So that was kind of the fentanyl equivalent for the military back then.
Yeah. And I don't want to go into it, but there's a lot of reasons that ketamine is one of the safest medications in the world. It's considered an essential medicine in virtually every hospital around the world, regardless of economic status. Okay.
Yeah.
Like, it's an extremely durable, hardy medicine that doesn't need a lot of, it doesn't have a lot of requirements, doesn't have to be refrigerated. So there's a lot of benefits in using it. It's so darn safe.
Right.
That I don't want to imply that there's, there are always safety factors we have to consider, but it's extremely safe medication.
Yeah.
So let me go back to the analogy.
Sure.
Okay. So what are the other colors of the chameleon? Let's start going a little higher, and now you can get into what we call the psycholytic experience. Are you familiar with that term, or should I explain that?
Psycholytic, we like to call that kind of a lower dose psychedelic experience paired with like a more talk therapy, as opposed to like the deeper, full psychedelic assisted psychotherapy, which is kind of like more medium to high dose.
I think that's a good working introduction. Cool. Understanding of it. Another way of thinking of it is lysis. What's lysis? It's dissolving. So what we're trying to do is just dissolve or soften some of the typical ego defenses. Okay. One of the challenges that any good conventional, therapist, no matter how talented they are, is that the human psyche has defenses. Everything we do, there's a reason why we do it, whether it's things that are functional, things that are dysfunctional. And so if we can even temporarily soften some of those defenses, I think that's in part how we can explain some of the tremendous efficacy, the tremendous results we can achieve with any agent or technique that can soften those ego defenses. Because I don't want to pretend that psychedelics are the only game in town. They're not. Yeah, tremendous value. And yes, in that, let's call it a trance state, a lower level trance state, somebody's ego is still there, but it's softer, maybe more flowing, maybe more receptive, maybe more intuitive. And yes, you can do very, very powerful talk therapy when somebody's in that state, because they have access to information and insights that they wouldn't otherwise. So now let's move on to another color of the chameleon. Now let's start getting to the quote psychedelic dose. Psychedelic, psyche, mind, delos, manifesting mind. Are we manifesting small mind? No, we're manifesting big mind. Right. So what are we doing with the psychedelic dosing? We're taking that ego softening to the next level. Now we're getting it really whisper quiet. Right. And that's when people can experience the more intense varieties of the expanded states. People can have experiences that some might describe as quote mystical, but just experiences of what it's like to have access to a psychic space where the ego is really, really quiet. And many people find that downright magical. People are not usually doing a lot of talking in that state.
Right.
It's not a great idea to ask them about their childhood. It'll be likely some version of mumble. And so, now let's go up the scale. Okay, so now we go even higher. Now we're maybe getting to the light to the anesthetic range. Ketamine was initially designed as an anesthesia agent to help people undergo medical procedures, even surgeries. To this day, around the world, it's used for that purpose. So at lighter doses, it can help, help people tolerate a potentially painful procedure that might be traumatizing otherwise. At extremely high doses, the ketamine alone can completely obliterate temporarily their conscious awareness, and now they're in a true state of anesthesia. So that's kind of the spectrum of the chameleon. Let's put it that way.
We had somebody. So this is a really far out non-medical application that we had somebody on the show talk about a while ago. He actually insufflated, I think, a half gram or a full gram in each nostril at one go. Lasts about 6-8 hours. And it's an interesting, like this idea of like high dose ketamine is really interesting because at the same time there's nothing happening, there still seems to be something happening. And I don't totally understand what that is. We talk about it as like a full dissociated state where there's no body. It's simply mind, seemingly. And this is on the psychic aspect, nothing to do with like what's going on in the body or medically with ketamine. Have you seen those high dose kind of like K-holes, I guess, in the popular parlance?
Absolutely. Another way of thinking of the quote K-hole, it's someone really entering a dissociative space. So I think I'd like to take a few moments to describe the term dissociation.
Please.
Because ketamine, in terms of its classification medically, it's a quote dissociative anesthetic. Any other use of ketamine is off-label, with the one exception of the recently branded Spravato, which is indicated. It's a ketamine analog that is indicated as a not necessarily as a standalone treatment, but as an adjunct treatment for major depressive disorder. Okay, but that's a very new addition to the saga, to the history. But the term dissociative. So in mental health circles, in many cases, in my opinion, the word dissociative gets kind of a bad rap. It's like, stop dissociating, deal with your issues, et cetera, et cetera. Like, we need to treat this dissociation. And I can see that. I can see that. But I'd like to maybe reframe the word dissociative. Like, with ketamine, chemically, we are in the ketamine state, we are becoming less and less in tune with outside sensory input. We are disassociating with ourselves as a body temporarily to some degree. And we are associating with ourselves as something other than body. And there's some real, I'm just going to go ahead and use the word. There's some real magic in that, possibly. There's some real healing potential to give people even a short temporary glance, a felt experience, not an idea, a felt experience of what is it like to really be a human being that is something other than body. And what terms people use, I'm going to let them have the terms that they're most comfortable with: soul, spirit, whatever, but something, mind, something other than body. And it's often very, very healing. So I look at it as an opportunity, because how many of us have that opportunity in our day-to-day lives? Okay, sure. If you're a 30-year meditator, you're in a monastery in Thailand for the last 20 years, you might have experiences of that on a regular basis. I don't know.
Perhaps. Yeah.
I don't know about you. That's not generally how I'm spending my normal days.
Yeah, for sure.
So yeah. So there's just, I try to reframe it as a positive, as an opportunity. And what that can do is it can give people a really needed break from ordinary mind. Because one of the challenges, the human mind is an incredible instrument, and if used for the right purposes, it can accomplish, incredible things, and has. Look at the modern wonders of our life and what we're able to send men to the moon or women to the moon, et cetera, et cetera. But as many of people have discovered who struggle with mental health issues and mental illness, is that same mind can be a torture chamber.
Oh yeah.
Yeah. And that's just the nature of being human. And in my opinion, any medication or technique or change in perception that can temporarily disrupt that rigid, what we call the rigid egoic self, the rigid self narrative that perpetuates kind of a negative, view of oneself in the world, can have tremendous value. Tremendous value in terms of healing and finding balance and wellness.
Yeah.
It just so happens that ketamine is a very efficient and effective and gentle and legal, way of doing that and accepting. What do I mean by accepting? There are many, or at least several, agents that have been used as entheogens in some traditional cultures, which are equally, helpful in potentially in promoting a healing response. But some of these agents, like for example, let's name it, like ayahuasca, used in many parts of the Amazonian basin for millennia, if not more. It's a very challenging medicine to use chemically. There's so many reasons why you can't do ayahuasca safely. A lot. So even if it was available legal today, it's not like I would be prescribing ayahuasca to most people. It's just not it wouldn't even be ethical because, for somebody to tolerate that, they'd have to go off of their antidepressant. And that's just
it's a whole project.
It's a whole project. And telling somebody who's really suffering, oh, by the way, we're going to just actually strip you off of your antidepressants. And just kind of please, just suck it up for a month while we do that. And then maybe you'll have this great healing experience and you'll have to stay off of it for another 3 weeks, by the way. That's just not going to be a conversation I'm going to really want to have with a lot of people. So what's my point? Ketamine, there's very few reasons why I couldn't safely use ketamine. There are a couple. But there's not nearly as many, and people can absolutely be on their antidepressants, and maybe we're going to even be using the ketamine to try to eventually wean them off of their antidepressant.
Right.
So that's a beautiful use of this medicine. So anyway, I don't know if I've kind of gone off on a tangent or not.
Well, we did really good. We covered a lot of territory by me not interrupting you for a bit there.
Sure.
I want to backtrack and say that my comment about pump and dump ketamine clinics might be a little harsh because I do know they help a lot of people. I think the best use is ketamine-assisted psychotherapy largely, but not everybody's ready for that.
I agree. And it's also tailoring the medicine to where the person is at.
Yeah.
If for whatever reason, if somebody's just, they're all talked out and they're not really in a space where they just want symptom relief, there's nothing wrong with that. There's absolutely nothing wrong. And maybe down the road, maybe they'll be open to the ketamine-assisted psychotherapy approach because they're ready for it. As a general, we want to get people the treatments they need when they're ready for it. I am of the opinion that, that as human beings, I'd like to think that, the healing that we need will become available when we are ready for it.
Yeah. We could see that internally and more manifest as well. I'm happy to know that there's great developments happening in orthopedic medicine, joint replacement. I'm glad that's out there for when I need it. I don't want to rush to have it now, but when I'm ready, I'm glad it's there.
Absolutely. And let me just put in one little point just in case we don't do it later. So, Joe, let's do a thought experiment.
Sure.
Or do a thought experiment. So what if the DEA representative came to me and said, Dr. Thomas, for the rest of your career, you only get one legal medication that can be used for psychedelic assisted psychotherapy You can have any one you want, but you better pick because you're not going to get another one. So if I was put in that position, the one that I'm going to choose is ketamine.
Yeah.
For various reasons. That's not to say that it's necessarily superior in its healing possibility to other agents. It really needs to be customized. One person may do wonderfully on ketamine. The next person might do better on psilocybin when that comes on board. But given its properties and its nature, ketamine is an incredible ally in the field of psychedelic therapy and seems to me to deliver a very incredible balance between efficacy, how well it works, safety, and cost and access to care. You know, and we can touch on that later if that would be a point of interest for your listeners, because I feel passionately that access to care is I'm going to be alive to those issues is really important.
It's such a big topic. It's not such a big topic. Easy discussion either. What's going
on in the larger society and the collective healing of the collective suffering, and it's just just over time, myself and many of my medical tribe and just psychedelic tribe in general, we really feel passionately about offering this medicine to people who need it as much as we can and finding ways to be creative about making that happen. So I'll leave it at that unless, you want to, go into that more.
This is something that could take days to unpack, but I kind of want to do it. So psychiatry therapy, not exactly cheap. If you're making like $7 to $10 an hour somewhere, like how can you really afford it? So like we ramp it up with like drug assisted psychotherapy, it becomes even more expensive. The weird thing about ketamine relative to a lot of these other drugs, correct me if I'm wrong, but for like a cap session, we're looking at like $1 a dose, like roughly. But I know there's other costs added to that.
Yeah, if that.
Yeah. So like we're looking at, an amazingly cheap drug, a super safe drug. But then when we have to pair it with like psychiatry or like a therapist sitter, like that might be where the situation is. But I think there's new exciting models we could explore. Like people get some mindfulness training and a little bit of sitter training, and we could really lower that cost. Where do you go with that access discussion?
So Joe, I'm kind of a centrist. I take sort of a middle ground. So I'd like to maybe present as much without judgment, just the spectrum of ketamine-assisted psychotherapy as I'm aware of it in my community. Okay, so there are. On the one end of the spectrum is the most conservative approach. So that's the approach that states that a physician, a prescribing ketamine physician, needs to be on site at all times if a patient is undergoing ketamine-assisted psychotherapy. And that's a good approach. That there's the wonderful thing about that. There's lots of safety that's built in to that approach. And lots of, there's opportunities to tweak things, to change the dose, to address side effects. However, it also, by definition, is going to be the most costly variant of the service spectrum. And so it's likely to, those who can access it are going to be, generally very resourced or honestly very desperate individuals who can find a way somehow by hook or by crook to leverage those resources. So that's a good way to do it. It's on the conservative side. Also legally, that's a conservative way to approach it from a risk management standpoint, from the practice.
Yeah.
The perhaps the most, shall we say, liberal approach that I'm aware of in ketamine-assisted, psychotherapy is perhaps the approach where, a client saw a psychiatrist who prescribes this, they gave them an ample supply of the medication, and perhaps the client is told that they can simply use it at home. They can have a psycholytic or psychedelic experience essentially unsupervised. That would be the most liberal. And there's a huge middle ground in between. Okay, what's a little bit more conservative than that? Maybe you mandate that that they have to do their sessions in the presence of a trained psychedelic therapist. Okay, that's a little bit more supervision. Maybe we give a little bit less medication at a given time, so that's a little bit more conservative. So my current approach, once again, I like to try to be a centrist. So I'm building a network of talented, ethical, and really kind-hearted psychedelic therapists who do this work. And what I like to do is I like to follow the gold standard of co-therapy, if at all possible, at least in the initial session. So I'm going to be there, preferably for the entire session, beginning to end, managing any needs that come up. They're going to have their therapist there as well. Therapist is largely going to be running the show in terms of the actual process, the content of the experience. I'll get into what a session's like a little bit later, because I think your listeners might be interested in that. But yeah, I'm going to see them through beginning to end, and I'm going to keep my antenna out, and I'm going to be paying attention to some very specific information. Like, one of the main questions I need to answer to myself is, how sensitive are they?
Right.
What kind of dosing do I need to be aiming to get them into an optimal psychic space? And there's both an art and a science to this. Just so listeners can see, can get a sense of my worldview. I usually have a very simple way of approaching it. There'll be a time after I dose somebody with their medicine that I'll come back and I'll check in on them, and I'll ask them, are they light, medium, or deep? And as a general rule, I'm aiming for the medium territory.
Mm-hmm.
Enough of a dose so they have a legitimate experience that's, markedly different from their experience of ordinary mind. Yet, on the other hand, I'm not going kind of overboard. I really don't think I'm doing most people a favor by pushing them off of a psychedelic cliff, especially on their first session. I don't know if that person will come back to me.
Yeah.
Yeah. And more importantly, I don't know if they'll get, if they're scared off, they're not getting the healing, the experience that they need. So there's a balance to be had. So I like to think that I'm conservative in the sense that I want to be safe and be gentle and give. But on the other hand, I don't want people to go home with their hands empty, empty-handed. They came for an experience. I want to give them that.
Right.
So anyway, so that's the first session, at least trying to get them into the medium territory. And, we can talk dosing a little later, in terms of what that means. And then as long as it's with a therapist that, that I am, very confident, comfortable with their work, I'll choose to allow the client to prescribe a small supply of ketamine tablets, specifically with the instructions to only be used when supervised by their psychedelic therapist. And if the tablets are used outside of a setting, that's a breach of contract, and I'm not obligated to prescribe anymore.
Right. I think that's a great approach.
They've lost their privilege, and they can have they can have a certain number of sessions with their therapist, and then eventually they're going to have to check in with me again. So, is it cheap? No. But whenever you limit MD time, there's going to be an overall net cost savings to the patient. And I trust that the therapists I work with, they're going to let me know if there's any safety concerns in any of the number of realms that could emerge, medically, psychologically, et cetera, et cetera. So,
yeah.
And the person, if they choose, at some point they can get me involved, and I'll often travel to the therapist's office, and I have the option of administering an injection, which is a deeper and allow for the possibility of potentially the more psychedelic type experiences. So it's what I call a hybrid. There's a back and forth, and I'd like to think that it's a good blend of safety, efficacy, and and access. And there's certainly much more that we can do, to improve the access even further. But I don't know. I feel good about that right now.
Mm. So are you largely doing lozenge for clients?
Largely, yeah, largely.
Cool.
Typically, what I'm going to do for the first session, I'm going to, I want to also make sure, because if the person's going to have the possibility of working with a lozenge session, with their therapist, I want to see for myself that their body can handle it, or if there's anything that I need to be aware of to give them a safer, more productive experience. Like, for example, managing side effects. Like a common one from ketamine is nausea. So in many people, I've got to come up with an anti-nausea plan.
Right.
And so what I'll typically do is that, give at least one lozenge in the first session. And then what I'm increasingly moving more towards now is then, not expecting that first lozenge to really take them to the optimal depth,
Mm-hmm.
but to then either give them another lozenge and or allow the opportunity for a very low dose IM booster so they can have at least a taste of that experience. Knowing full well that's a very different experience than the high dose IM experience.
That's cool. It's kind of like a calibration session.
Yeah, and I'm moving towards that model. It seems to be working well. People are usually very appreciative and I seem to be getting really good feedback from it. There's time efficiency built into that model. Because Joe, one of the things about, I think, psychedelic therapy in general is that there are exceptions, but by and large, the medicine is not the choke point in terms of cost. Like ketamine's, as you mentioned, dirt cheap. The costliness in the therapy is paying for professionals' time.
Right.
And ketamine, I don't see it getting any less expensive than ketamine, because it's theoretically possible to do a ketamine session from beginning to end in 2 hours. There are, many people out there who prefer more time and will charge for that appropriately, but it is possible to do a session in that time frame. Think of an MDMA session, right? How long is that?
Hours
7,
and hours.
8 hours. With two professionals involved, it's incredible medicine. I think it's a wonderful thing, but you can see how the cost basis is going to be different. Imagine when psilocybin comes online, and we're talking minimum of 5 to 6 hour experience for most people, right?
Yep.
So there's that I think it's an issue. But so ketamine, and that's in part backing up my previous assertion that ketamine would be my choice if I only had one agent forever.
Yeah. Makes a lot of sense. It's just practical, cheap. Time is not anywhere close to the traditional time we think of psychedelic psychotherapy, and you get to still do a lot of great work.
Absolutely. Yeah. Well, and I think another and a thing that maybe the listeners might want to hear about is that one of the wonderful things about working with ketamine is that it carries a paradox, and the paradox as I see it is the medicine is simultaneously powerful and gentle. So if you think about some of the traditional entheogens, things like ayahuasca and some other iboga, et cetera, powerful, yes. Gentle?
Right.
Depends on who you ask, but many people would might not corroborate the gentle part, right? Yeah. So, in my opinion, and then many of those that I work with in this professional space, there's a gentleness. Even if I'm going high dose, I am experienced. There's a gentleness that seems to be one of the signature traits of this medicine, which makes it a really valuable clinical ally.
Totally. Yeah. So here's a question about ketamine in kind of a lozenge form, and circling back a little bit to this idea of the smaller the amount of medicine, typically the better. So from your medical perspective, like how much safer is IM versus lozenge? Like, do you think the risk profile to like, I don't really know what the terminology is, but when it hurts when you pee or something, when you have ketamine in your system?
Hysteria. Yeah, that's a great question. And let me just preface that I've read some of the research in this area. I
Sure.
am not a researcher, and I
Hmm.
don't want to pretend to be something I'm not. So if any of my colleagues are listening to this and have a comment on it, I'd be definitely open to their feedback. But uh, let's just say, from my current understanding, ketamine is safe regardless of its form. Whether it's oral, intramuscular, injection. Some people are using it creatively, like subcutaneous below the skin. Whatever, it's still a safe molecule regardless. Now, that being said, in terms of possibility of side effects, I do think that you're probably generally likely to, if you're gonna have a significant side effect from ketamine, let's say, the side effect of being a stimulant to the person's system and increasing their cardiovascular load.
Yeah.
Sure, you're probably going to get more of that with a high dose injection or a high dose intravenous session than you are from a low dose lozenge. I
Right.
mean, lower dose generally equals lower side effects, and there is an exception to that, and that exception is nausea. You're actually much more likely to get nausea with the tablet version than you are, or lozenge version than you are with either the injection or the intramuscular.
Mm.
In terms of safety, the intravenous is I think arguably the quote safest version of ketamine, simply because you can turn it off at any time. You're
Yeah.
infusing for a period of time, and let's say that we were doing a session on you, we noticed your blood pressure was spiking, you're breathing a little fast. I could turn off that drip, and reasonably quickly the medication levels are going to start to drop, and that whatever issue came up is going to start getting better, probably quicker than if we were doing an injection, because an injection, once it's in, it's going to run its course.
Right.
Have peak effect for about 45 to 60 minutes, and we can hold your hand, we can comfort you, but the medicine's in.
Mm-hmm.
In my opinion, I don't, I guess in my practice, I don't have access to an IV suite, so I don't know what it's really like to administer that route. My patients have generally done great with the injections,
Mm-hmm.
especially if I'm trying to aim on the side of caution in the dosing. It's a safe medicine no matter how you slice it, but there are, I suppose, different gradations and levels of safety.
Yeah. Yeah. Well, it's good to know.
And on that topic, just so the listeners know, like just from the spectrum of how people use this medicine, I've got some very well-respected colleagues in the greater Boulder, Denver area that they're actually doing true ketamine-assisted psychotherapy with IV infusion and having marvelous results. And so that route can be very, very powerful.
It's an amazing way to titrate the experience. Like, okay, like cool, you're in there for 5 minutes and you're chilling. Now let's ramp it up a little bit more and a little bit more. Yeah, it's like
Sure.
like a DJ almost versus like,
Right.
yeah, you just turn on and
Anyone
off.
listening out there wants to donate an IV suite with a resident nurse or EMT, I'm open to it.
Perfect.
Let's talk.
Yeah. Yeah. There's so much room in this ketamine space for more people to come on and more options. Like you don't have to hold on for MAPS to finally accept you to the training.
Right.
And then to wait a couple more years for it to become prescribable, right? This is here now.
Exactly. And that's one of the real beauties of this medicine is here now. I love that.
Yeah.
Yeah, absolutely.
Really briefly, because I probably only have about 5 more minutes to hang out, but I'm curious about your perspective on breathwork as an integration tool, something like holotropic breathwork.
Yeah. Yeah, I am a big proponent of holotropic breathwork. One of the, it seems like one of the final common pathways, shall we say, of any medicine or technique that can induce a non-ordinary state is temporarily softening the ruminative, negative self-narrative that's so characteristic of human suffering and mental illness. Okay, so that can be and how you achieve that state in some ways is, potentially not even that important. That may be an overstatement, but what's my point? Holotropic breathwork, or what I call journey breathwork, in any of its forms, absolutely can soften that egoic function and give people access to the parts of themselves that are bigger than that negative self-narrative, and just to bask in the juiciness of what's possible when that happens. So in my opinion, the use of journey breathwork, intentional, deep breathwork that induces a trance state, I think it can be a tremendous integration tool after a psychedelic session, because it can really get people in their bodies and also teach them that they don't need to have a chemical to always achieve that state. Incredible healing can happen, just with the air that they're breathing in and the lungs that are taking it in. And I think from a pragmatic standpoint, if we were to use breath work as a interim integration tools between sessions, could we get away with maybe slightly decreasing the frequency of the more expensive psychedelic sessions?
Mm-hmm.
How might there be societal value in that while still retaining the efficacy and the self-learning and the insights and all of the good stuff that goes along with that? No one studied it, at least that I'm aware of.
There's some clinical data on holotropic breathwork, but it's largely done outside the States. Like Russia did a whole bunch.
Right. But specifically holotropic breathwork as an integration tool.
Near zero. Yeah, if any.
Yeah. Please tell me, because if I'm aware, if you're aware, because I'm not.
I would love to know it. I would love to actually run that trial. So if anybody wants to fund me, let's go.
And I don't mind telling the audience, I have had some amazing experiences with the journey breathwork myself, and I've just seen the value and the healing in my own life, and I'd love for the word to get out, and groups like yours who can promote that work. I love it.
Yeah, it's so cool. Like I love that. For the most part, it's safe for anybody. Like I'm able to screen people comfortably. Myself, and it can be done almost anywhere.
Mm-hmm.
It's unbelievable. I think only in France there's some weird things about breathwork. I think the government flagged holotropic breathwork as a cult a while back. Nowhere else in the world, just there. And it was during a cult mania.
I'll tell the listener, and you're going to know more about this topic than I will, but the one thing I'll caution the listeners is please don't dismiss breathwork as a lesser. It can really bring out people's stuff in ways that usually you might find fascinating and amazing, and it's just the releases of trauma and pain that are possible. I mean, it could really feel like somebody is in, that there's a whole group of people who are in the throngs of a deep psychedelic medicine, yet there's not a chemical in their body, right? That's being put in.
Yeah.
So interesting.
Yeah, absolutely. Like Stan Groff, along with my mentor Lenny, said the thing that really convinced them about holotropic breathwork was that the experience was identical to high dose LSD sessions. This is not every time, but this is on occasion. This can happen.
I can see that.
Yeah, cool. Well, Dr. Thomas, I think I've got to run, but let's give you a moment to talk about your practice, where people can learn more about you. And
so, let me just kind of keep this brief.
Yeah.
So my practice is called Clarity Integrative Psychiatry. If you guys wanted to Google Clarity Psychiatry Boulder or Clarity Psychiatry Colorado, you're going to come up with the website. And if you happen to be in the greater Boulder area or willing to drive here, we absolutely, could consider, if audience members need some help and if we could be of service and it's possible, yeah, let's talk. They would likely interface with my very capable and competent, what I call my high priestess of scheduling, Katya. And she'll take good care of them.
Excellent.
And
Excellent.
I'm going to leave it at that. There's a lot of really trusted colleagues that are doing this work. And I consider myself to be lucky enough to be part of a movement.
Yeah.
It's not about me and my practice. This is a movement of healing and self-empowerment. Let's do this.
Absolutely. Well, Dr. Thomas, I really appreciate you coming on the show. And I hope we can link up in person in the future.
I'd love that. Next time I'm in Breck, I'll look you up.
And there you have it, Dr. Thomas. I hope you all liked it. It was a really fun episode. And I think you will be hearing more from Dr. Thomas and I in the future. So I'm hoping to meet Dr. Thomas in the next few months, but we haven't really talked about it. And just really grateful for him spreading this knowledge and working in the field. It is a field with a lot of problems and a lot of risky avenues. And I'm just grateful that Dr. Thomas felt comfortable enough to move into this kind of psychedelic, ketamine, integrative angle on psychiatry. How often do you hear a doctor actually talk about supplements and mean it? Honestly. But yeah, like there's a lot of factors that go into health and mental health, and to ignore big portions of them is a mistake. So I guess that's it for right now. I hope you liked that. And a reminder that we do have an 8-week program coming up in January for clinicians, therapists, coaches, whoever's interested, really. But just know that we're coming at it from a really high level. This is not, for somebody in high school, really. Like, this is for people who are planning to go into medicine or coaching, or are in medicine or coaching. And we have a lot of depth here, a lot of master classes from expert people from around the world in their sub-aspect specialty in psychedelics. And yeah, it's just an amazing 8-week program, a lot of live support from us, and a Slack group. You get to build your network around the world too over the course of the class. And there's 2 time slots, I think noon and 5 Mountain Time, 2 and 7 Eastern U.S. time. So, and everything's recorded. So if you miss a class, it's not a problem. There's no pressure to attend every class unless you're shooting for CEs. And if you're shooting for CEs, you do need to be there. If you have any questions, hit us up, Psychedelics Today, email@gmail.com. If you want to learn more about the class, check it out at psychedeliceducationcenter.com. And I think that's it for now. I hope you all have a great rest of your day, and we will see you on the next episode. Joe Moore, signing off. Bye-bye.